Hello everyone, today we are going to talk about polio virus. It is a viral infection. Here we can talk about introduction of polio virus, then we talk about transmission and its sign and symptoms. After that we are going to talk about diagnosis, how to diagnose, treatment plans and prevention, how to prevent polio virus. Okay, so let's get started. Here are the patient polio virus vaccine, the case of polio virus. Okay, first of all, we talk about introduction. It is a viral disease, a viral infection. Okay, it mainly affects nervous system and spinal cord and brainstem. It only affects spinal cord and brainstem. Okay, nerves, through nerves. Okay, it only affects nerves of spinal cord and brainstem. Okay, it causes mild or no symptom in most people. It causes no or mild symptom in most people, but some people causes paralysis. In some cases it causes paralysis or death. Okay, next we will talk about, it is the most severe form of viral infection. It is most severe form of viral infection in all forms. Okay, transmission, how to transmit this disease person to person. Okay, person to person contact. ठीक है, okay, contaminated food and water, via contaminated food and water, and focal oral route, via oral routes. Okay, sneezing. Okay, now we talk about types and symptoms. Here we have types and symptoms. We are talk about, in most cases it don't get symptoms. In most cases polio virus patient don't get symptoms in earlier stage with its stage. Okay, there are 4 types of polio virus. Okay, here first type, abortive, non-paralytic, paralytic and post polio syndrome. First of all, you talk about abortive polio virus. Okay, it's 5% of total polio virus gets mild version or abortive poliomyelitis. It means if 100% of polio virus case, then only 5% are patient getting 5% of abortive poliomyelitis, and some patients are getting abortive poliomyelitis, maybe 1% or 2%. Okay, now we talk about it leads to flu like symptom last to 2 days. It's okay, it's fever symptoms just like fever, headache, muscle pain, sore throat, loss of appetite, abdominal pain, nausea, vomiting. And then we talk about second types, non-paralytic polio. Okay, non-paralytic polio, it is more severe form of disease. Okay, affect only 1% of the people. It only affect 1% of people, does not causes paralysis. So that it is called non-paralytic polio. Okay, symptom includes neck stiffness, neck pain, aches, stiffness on arms of leg, stiffness of arms and leg, and pain in arms and legs. Okay, both stiffness and pain in arms or legs. Okay, severe headache, decreased reflexes are decreases in this case. Okay, or muscle weakness, here muscle weakness, muscles pain, fatigueness. Okay, now we're talking about third type, paralytic polio. It's is most serious form of disease, mostly occurs in polio cases. Okay, begins like non-paralytic. It's just like non-paralytic, but symptoms are different. Okay, it progresses to more severe sign and symptoms. Okay, here we talk about sign and symptoms: intense pain, extreme sensitivity to touch. Okay, tingling and prickling sensation, muscle spasm, twitching sensation. Okay, twitching of muscles, muscle weakness, limb paralysis mostly in legs, limbs paralysis mostly in legs, breathing muscle paralysis, it means breathing muscles paralysis. Okay, difficulty in swelling. Of course, when muscles of breathing are paralyzing, then it's complicated to swelling. And okay, post polio syndrome. Now we're talking about 4 type of polio. It is 4 type post polio syndrome. Okay, it happens usually after decades of polio. New sign and symptoms are appearance. Okay, here we seen new and sign and symptoms. Okay, joint pain, muscle pain and weakness, fatigueness, muscle wasting, breathing or swelling problems, okay, sleep apnea, okay, sleep disorder, it is sleep disorder, lower tolerance in cold temperature, lower tolerance in cold temperature. Okay, now we talk about diagnosis, how to diagnose polio patient. First of all we diagnose with physical examination, okay, then we go for saliva test, stool test and blood test, okay. Lastly we are go for cerebral spinal fluid test, CSF test, okay, it's CSF test, okay, it is CSF test, okay. Here we talk about treatment. There is no specific treatment for this polio, it might be able to improve symptoms, we can only improve symptom of polio, okay. Drinking fluid, using heat packs, ibuprofen, painkiller, okay, exercise, bed rest, okay, portable ventilation for the symptoms, okay. This treatment can only improve symptoms of polio cases, okay. Now we talk about prevention, how to prevent polio patient by giving vaccination, by polio vaccine, inactivated polio vaccine, okay. It have 4 doses. First dose given in 2 month of age, of child. Then second dose, this is first dose, this is second dose, okay, second, this one is third, okay. Second dose is given in 4 month of age, okay, and third dose given in 6 to 18 month of age, and fourth dose given to 4 to 6 month of age, okay. That is 4 total doses of polio cases, polio virus cases. If you like the video, then like, share and subscribe. Thank you.